Doctor, thank you so much for being here. It is such a pleasure to have you on Connecticut Voice Out Loud, sharing your expertise in the area of infectious disease and about the pandemic and COVID. Dr. Alina Filizov, she is the chair of infectious disease and also the hospital epidemiologist at Middlesex Health. And it is such a pleasure to have you here. Thank you so much.
Thank you for inviting me to your program.
Where are you seeing things as somebody who is in your line of work and how the vaccines are working and moving forward?
Thanks, Hillary. So this is an exciting time, but it's a very important time. Believe it or not, we are really in a race. We have to immunize people really fast before the virus starts mutating even more and causes another wave of infections. Because of really severe outbreaks we had so far, it's really important that everybody who is qualified to receive one of the available 3 vaccines, again, exciting times, we have 3 vaccines now, we encourage them to sign up and receive the dose. So we have Moderna vaccine, Pfizer vaccine, which is both of them are 2 doses mRNA vaccines, and then we have Johnson & Johnson that was just approved. All these vaccines are excellent protection for our patients, for our healthcare workers, for everyone who is part of this pandemic, which is the whole population of the world, to curb this pandemic so we can return to normal lives as soon as possible.
What kind of precautions need to be taken, even if you are vaccinated?
Unfortunately, until we have very low numbers across the country, we have to maintain the same level of precautions. Masking, social distancing, hand washing, avoiding crowds, the same kind of precautions. When we have numbers, and again, not just about your state, but about the whole country, when the whole country, and hopefully the world as well, have this pandemic under control and more people are vaccinated, then we will see a significant improvement in the number of cases and obviously as a result, a number of variants and secondary cases.
With the LGBTQIA plus community, your work with Middlesex, and also there being a really strong transgender medicine program at Middlesex, are there certain precautions that need to be taken for those who are in transition, the transgender community, as far as the medications they might be taking or people that are considering the transition? Does it impact them at all, this vaccine, any differently from any other community?
No, it doesn't. So anyone, whether they in transition or not, have the same risks of side effects, for example, and really similar risks of exposure to the COVID virus itself. So no, there would be no difference in precautions or advice for somebody to receive the vaccine. And as you know, our state or many other states using an age-based approach to the vaccination. So it wouldn't matter if you're a 50-year-old in transition or 50-year-old woman or 50-year-old man. You would qualify based on certain criteria when your time comes.
In the time of COVID and the pandemic, it's already impacting people on a whole, being isolated, social distancing. What advice would you give for a community like the trans community that tends to be isolated already and kind of alienated in many respects? How do we nurture that community and make sure they're protected and they're nurtured during this time? And I know Middlesex has a number of programs for that as well.
Yes, I mean, it's definitely a big problem for multiple communities, but especially to transgender community, which needs support even under normal conditions. So we do have group therapies that our program, transgender program, is sort of sponsoring. Obviously, we have active behavioral health practices and services that somebody who needs extra help can apply for those. If the person comes to the emergency room with psychological issues, psychiatric issues, there could be a referral to behavioral health and group therapy as well, or group support as well, for them to find people in their community and in the relatable community to kind of share their views. And as we are communicating via Zoom, this is a platform that has brought many people together, even though they can't get together physically, at least on an emotional level. I think I would encourage everybody to take advantage.
Doctor, thank you so much for sharing your time, your expertise, and keeping us in the know and abreast of everything going on with the pandemic. It's a pleasure, and I appreciate your time.
Thank you very much, Hillary.